Hello, good morning, everyone. Thank you for attending this webinar about sustainable housing to support health and well-being. First of all, I wanted to give the floor to Irina Calderón. She is the EC representative, European Commission representative, and she will do the welcome statement. Irina is policy officer in DG Connect in the unit of e-health, well-being and aging. She's working on active and healthy aging, silver economy, health tech ecosystems, health innovation and genomics. And before 2017, Irina has worked in DG Regio as well as the United Nations Office of the High Commissioner for Human Rights. Please, Irina, when you want, you can give us the welcome.
Yes, hello and good morning, everybody. First of all, thanks very much for this invitation. As you know very well, the Commission has put its as its main priorities digital and green transformation, and in line with these priorities, today's conference is of great interest to the Commission. This green and digital transformation are there not only to bring us as citizens benefits and better well-being and sustainability, they're also there to bring us some economical benefits and opportunities. And I think that we would hear today many interesting interventions which could be good examples for that. You know already that our unit, but also other services of the Commission have supported throughout Horizon 2020 and before the uptake of digital technologies for better health and care and for aging actively, independently, also in our homes and in our communities. And I think that these activities have really demonstrated how we could possibly also address this demographic change which our continent is going through and which is going to continue to be there as we are aging, and the shortages of our health and care systems are not going probably to be met very easily. Anyway, I am very honored to be here today. I think that I would learn many interesting things from your project and from the challenges that you face, and also from your achievements. And I'm looking forward to your presentations, and I wish you a great day. Thank you.
Okay, thank you very much, Irina, for this welcome and for your nice, kind words. Well, now I will give you a brief overview about how it's going to be structured, the workshop. This workshop has bring together a selection of different European Commission supported initiatives in different programs, which are developing innovative solutions to push the investment in sustainable housing and living environments which support health and well-being of its occupants. We all know the importance of having a cross-cutting approach to the issue of age-friendly environments, and it's very clear. Even WHO let clear it when they launched the guide for age-friendly cities. They identified 8 different domains that has to be considered. And the projects we are presenting now, they tackle all the domains. I mean, even if each of them perhaps has a specific focus in one of them, they push in all the other domains also. And I think that this is something that is clear. We'll know that to turn our cities and our environments and our houses age-friendly is not one silo thing. Everyone must be involved. So while I present here the agenda, we will have 4 different blocks. As you can see, we have housing enabler market analysis, where one with aging project will be presented, and then we will have a slot for questions and answers. You can find the questions box in the right of your screen, where at least is in the right of my screen. You can write all your questions, and when we have the questions and answer slot, my colleague Ola Nicolas, he will be moderating them. Then we have a second block about innovative solutions for housing supporting health and well-being. The same, we will have the presentation of 3 different projects, and then we will have a questions and answer slot. Then we will have a short break so that you can go and take a quick coffee or anything. Then we will have the last 2 blocks, one support and investment into an implementation of age-friendly housing, and another one about get involved age-friendly housing, networking and clustering. And then we will have the last slots of questions and answers and the discussion and the conclusion. While we are having the workshop, we will launch some pulse questions. These pool questions are just to know more about you and to establish some general numbers about the situation of Europe regarding the aging population. So I think that we can start. I don't know, Regis, if you are going to launch the first question pool.
The poll is now online.
No puedo ver. You cannot?
No, los operadores están listos ahora.
It's mostly for the attendees that can answer that poll. A little bit of time. Then you are able to click on that link. Yeah. Oops. So we have mostly representatives from research, either academic or industry, and also from housing organizations today.
Okay, great. Perhaps we should try to launch it at the end of the workshop if more people has joined.
Yeah.
Okay, so I think we can go on with the first presenter in the first block, that is housing enabler and market analysis. Aline Olivier, sorry for the pronunciation of the name. She's an occupational therapist and researcher at Vives University College. Her expertise is aging in place, and she will present aging project that is a cross-border cooperation to enhance aging in place by adaptations in the home environment and to address loneliness and social isolation. So please, when you want, you can start, Aline. Thank you.
Hello, good morning. I hope you can see my screen. Can
yes,
you?
it works. Yes.
I cannot see my presentation, so that is not a good start. Okay. Okay, so this works. Okay, so good morning. My name is Aline Olivier. So it was quite a good pronunciation, so thank you. I'm going to present to you Age In project. Age In is age independently. And what is our main objective is to keep the aging population independent as long as possible, and as long as possible in their own home. So that is a target that is not that weird, definitely not those coming those days with COVID as well. People want to age in place as long as they want. and want to keep aging in place, and that is our main objective as well for this project. This is our group, our partner group. It's quite a big group. We have a partnership with the lead partner of Boulogne-sur-Mer Development Côte-d'Opale. We have a partnership with municipalities from Belgium, with community centers from France and Bruges, housing sector partners from France and the Netherlands, 2 universities, Vives, that's where I am working, and the University of Plymouth in the UK. And we have 2 other organizations like Volunteer and Network of Companies as well, dealing with health issues. So that is our big partnership. It's quite a big group, so that is rather challenging. What is our main output? Our main output, the first output line, is to adapt housing and public space. So first we want to understand the current needs. So we had done a lot of screenings, interviews, and literature searches. I will explain later on, with the intention to empower the 55 plus to adapt their houses and to remain as independent as possible. Another main output line is to strengthen social links and reduce social isolation. For that, we have strategies to detect isolated seniors, and we have built pilot actions with social networks as well to tackle social isolation and loneliness. We have a few pilots as well in all our partnerships in all our countries. So now I'm going to tell you something more about about our housing. So I told you in the beginning that we had done a lot of screenings and assessments to see how are the houses like these days. And for that, we done the Housing Enabler. The Housing Enabler is an assessment tool from Susanne Ivarsson from Sweden and Björn Slag. They have developed it, so we had followed the complete training as requested, otherwise you cannot even assess. And the Housing Enabler is a tool to have an idea, a clear vision in how are the houses like these days. Are they built for aging in place, or are there specific barriers that we should keep in mind? So that we have done. We have done it in Belgium, but as well in the Netherlands. But in the Netherlands, they're not finished due to Corona. Of course, we couldn't visit houses anymore. So we had a put on the pause button for a while. So this presentation will only have the results of Belgium. And in Belgium, we have assessed 110 houses, of which put the screen up, yeah. Just about more and a half were houses. We have multi-dwelling houses and we had bungalows. Okay, the location of those houses were in the city, 31% suburb, more than half, and a bit of rural houses. So we tried to have a good sampling, that we have a bit of each, but this is a normal distribution of where the most people live. The mean construction date was 1960, and the birth year of the residents had a mean of 1946. So that gives something of an idea. So the Housing Enabler works as well with profiles. A profile, and those profiles, of course, are valid. Those are developed by the authors of the Housing Enabler. You have 4 profiles in which you can have accessibility problems. The first profile is only limitation in mobility, so reduced function, spine, balance, endurance, coordination. Second profile has limitations in mobility and upper limb. Third profile is limitation in mobility, upper limb dependency on mobility aids, so that's quite another profile. And the fourth profile adds up with a loss of vision. I'm going to go I'm going to tell more about those profiles in a minute. So I'm going to present a little bit the main issues with our housing in Belgium. And could be valuable, of course, if you can have a thought how that would be in your own country or for your own people living at home. Do you recognize the problems and I am talking about, or do you have a completely other setting? That's why we did the housing enabler in a few countries, in Belgium, in Netherlands, and France. So we can actually compare, because there is a lot of cultural differences in those houses. So first I'll talk about the accessibility problem score. The higher the score, the higher the accessibility problem for a specific profile. For now, I'm only presenting profile 1 because that had the most remarkable differences. We have a difference in the accessibility problem score between regular houses, community dwelling houses, and between bungalows. We had that for the entrances, the indoor environment, and the total score. So the entrances of apartment buildings or community dwelling buildings have significant more barriers than houses and bungalows. So the entrance areas, it has a significant difference. And the indoor environment of houses has significant more barriers compared to community dwellings and bungalows. So that is rather a remarkable difference. So now I'm going to present to you very short, I will try, because I want to tell you something else as well, about the main topics of the screening. So those are the main topics. Yeah? Bathroom, kitchen, general indoor, entrances, and exterior. Of course, you will have the presentation later on to dive into the deep and see what else you wanted to know with more details. That is not a problem. For now, I am limited on time, so I'll try to make the best out of it. So exterior, we have assessed all houses. So we actually went there with and measured everything. So we started with the exterior environment of houses, bungalows, and community dwelling apartments. For profile 1, we have a lot of barriers and the exterior surroundings, and the high curbs, and a curb shouldn't be more than 4 centimeters, was one of the most remarkable barriers. You see the measurements in red, and we see that from the 64 people that we have measured with, they had a high, more than a 4 centimeter curb. And if we took an average of all the curbs that we have measured, we found almost a curb of 10 centimeters. It's rather high. That's too high. It's even a difference of 6 centimeters. As well, with profile 1, a barrier is an irregular and uneven surface. A few problems with the letterbox and with the refuse room. The letterbox is often only reachable by steps or differences in level, difficult to reach in height, and with the refuse room or the bin, which is only reachable by steps or other differences in level, and as well difficult to reach. An unsafe surface in the car park was as well one of the barriers, the most remarkable barriers for the exterior surroundings. For profile 2, we only had one extra to add up, and that is no resting surfaces. For profile 3 and 4, there were no specific remarkable barriers to mention. The entrances. So entrances are all the entrances to the house. It's your front door, as well as your back door. And for the entrances, it's the first 2 barriers are the most remarkable ones. That's for profile 1. So if you have only limitations in mobility, like reduced function of lower limbs and spine balance, endurance, and coordination, the most 2 frequently barriers are the height thresholds or steps at the entrance. They shouldn't be more than 15 millimeters. And there is and the sitting out place or the balcony has level difference. So for the first one, it shouldn't be more than 15 millimeters. You can see my numbers in red. We have measured those, and from our 110 participants, 97 people mentioned that we measured. Actually, they did mention it to us that their threshold was higher or step higher than 15 millimeters. And when we actually measured it, it was 11 centimeters. as an average. That's really a high difference. As well for the sitting out place and balcony. The doors and the entrances had a few problems, but as well the stairs and the lifts. Profile 2 didn't have a very specific barrier, but Profile 3 had a narrow door opening as a problem, which has a difference in centimeters for about 10 centimeters, wide gaps in the floor, and not enough space to maneuver indoor. Then as well we have the indoor in general. Indoor in general have had a few remarkable barriers as well. The stairs, quite a big issue to mention. The stairs had threads with narrow, irregular depths, necessary stairs for dwelling functions, upstairs, basement, laundry room. So all those areas to be accessible had necessary stairs. High, low, or irregular heights of risers, no handrails or only on one side, and handrails were often too short. You can see the measurements below as well if you have interest in more details. So for general indoor, the stairs were definitely a big issue. To add up on that, Profile 2, limitation in mobility and upper limb, had difficulty with manipulation of controls. It required a hand function, turning motion in the wrist, required the use of fingers, and the controls were often very, very small. The Profile 3 and 4, you can see a few of the biggest barriers mentioned there as well. So for Profile 4, because we haven't mentioned that one a lot, it has a loss in vision as well. So the tactile cues to stairways in the circulation path, those were often lacking for people with vision loss. So I'm going to go quickly to the kitchen and to the bathroom because I can see I'm running out of time already. The kitchen, 4 profiles again. So for the first profile, we can see there are wall-mounted cupboards and shelves. They're often placed too high, but with a good intention and a good reorganization of your kitchen, I think it's easy to assess that problem and easy to solve. As well, there was insufficient maneuvering space around storage units, no working surface with legroom, and no surface at height suitable for sitting while working. So as well, there was 84 centimeters or lower is required, and in 92 people we found that it had an average of 90 centimeters. That's quite a big difference. Profile 2 had as well some limitations and barriers mentioned, and Profile 4 with the vision loss as well had the ceramic hobs as the most frequent barrier. Bathroom, I hope it's not going to be anything new I'm telling here. I think you all know the bathroom is rather a place that is the most problematic. So that I had to make a big selection because I could only mention a few to make it visually readable. So here we have no grab bar at the shower, bath, or toilet. It was the most frequent barrier, never mentioned in the houses. The height, the leg room, the toilet that is often too low. You can see, and that is what I mean with cultural differences. The toilet too low, 47 centimeters or lower, and in 87% of our respondents, the toilet had an average height of 42 centimeters. Of course, it has to do with architects and building engineers who are placing those toilets. I cannot put my toilet just like that a bit higher. That is not possible. So it's a structural problem. So this is a bathroom. You can read later on if you have more interest in the details. So I'm going to tell you a quick story as well about our market research. So what about technology? We often say technology is easy accessible to Asian players. There is so much available, but how should you use it? For what technology can help you in aging in place. So we started with a systematic review to capture the effectiveness of technology to age in place. We have the systematic review is finished, and it is actually going through the final stage of publication. And our key conclusion was there is more evidence needed among the effectiveness of home health technology in healthy older adults. And why is it so remarkable? Remarkable is that we actually focused on the preventive aspect. So we didn't look for any disease-specific technology. We had a look for general home health technology to enhance aging in place. So all kinds of technology that can actually help you and have an added value to keep your health and to keep your independent functioning. And if we had a look for that, we saw there is not that much evidence available. But for the identified technologies that we did found, they do focus on accessible communication, emergency assistance, physical well-being, and mental well-being. And when studying their effectiveness, we see that those mentioned technologies, so the use of a neurofeedback headband and EEG system, an accessible computer system, a wristband with pedometer, a biofeedback device, and an online video platform can bring added value to age in place. For more details, I will send you a link to our website. As well, very important is the patient-centeredness. It is very crucial in developing, evaluating, and integrating technology at home. If you want to succeed with technology to age in place, you should introduce the technology with guidance, training, and follow-up. Don't just drop it there. It won't work. You need guidance, training, and definitely something in the long term to follow up. So in my title, it was mentioned that we did a market research, and what was the intention? We wanted to have an idea clustered with teams, what kind of technology is available to age in place, but it needed to be easy accessible. So it needed to be off the shelf, just like someone Googling a bit and say, okay, I can easily order it, I can go to the shop and I can actually just buy it. I don't need to have a functional limitation for it. No, the market research focused as well for aging in place technology, easily accessible, easily understandable. I have to say this market research is cultural, so it's off-the-shelf technology accessible in Belgium. Those are the themes that we have identified. So health monitoring, physical well-being, mental well-being. And if you go through our document, the link is a bit further in the presentation, you will see that we have identified a lot of technologies within each team. So I cannot go through it because I don't have that much time. I think my time is probably stopped. But those are the themes that we have identified, and it's has easy accessible technology ready to age in place. So what are we going to do with those technologies? Because now we only say, for example, a smartwatch is easy and it's easy accessible, but then we as well want to capture some user feedback and tailored interactive demonstrational material with people who actually want to buy the kind of technology. So we will develop video material and we will develop demonstrational material easily accessible and accessible in all languages of our partnership. That's Dutch, French, English, and yeah, that's it. So we will spread those videos as well to raise awareness, because that is a very important one. We want to raise awareness, we want to spread information easily accessible to our target group, and to make sure they know what kind of technology is there, is on the market, is easily accessible, how should I use it? And with our demonstration videos, we hope that we can answer that question. Last slide. This is a sneak peek of our innovative cooking platform. As well, we are focusing on developing technology. So with this system, we want to develop a technology that supports independent cooking. So with verbal and illustrative guidance through all the cooking process, as you can see up here, with steps and video material. So that is coming up, but not finished at all. So I'm going to wrap up. This is the link of our, two links actually, of our websites. You can always contact me if you have questions or you want to read the document in English, because I think I only have uploaded the Dutch version. So you can find some more information up there. Okay, if there are any questions, I'm happy to listen. And now I should click stop share.
Okay. Thank you, Aline. Thank you very much. I was just leaving you more time because we don't have many questions, although we have a pair of them. We are not going to launch now the next pools because we don't have many attendees for the moment. People is sleepy today, so let's wait to see if more people will join later. And we have a pair of questions that my colleague Olatz will launch to you.
Yeah. Well, Aline, thank you very much for your presentation. Yeah, one of the questions has to do with the cultural differences. How were they taken into account, these cultural differences among the different countries that you are tackling?
I'm sorry, I didn't capture the question. Can you repeat?
Yeah, the question is about the how cultural differences among countries have been taken into account to develop these technologies and this
Okay.
research also.
For the technology frame. So for the technologies, we have identified a market research only for Belgium because we wanted to take encounter the language barrier, which is probably there. If we present a technology to a certain people who has interest in something, we cannot give them something in an English language. It's not going to work. It needs to be in Dutch, of course. And our instructional movies and demonstrational movies will be in Dutch as well. But we are actually working on the French edition. So my colleagues in partnerships have identified a few French technologies which we will add, and then we will have a French version as well. So we are still working a bit on that, but the English version and the Dutch version is ready.
And how were these users, the age people, got involved in the development of these technologies? How did you propose those the participation? What kind of dynamics that you used? Can you explain that a little bit?
We used the participatory design, the co-design principles we used. So we actually constantly go into interaction with people. We have done a lot of focus groups as well to capture the needs and the barriers to make sure that we identify technology that they actually are interested in, and to test them and demonstrate them. It's with a co-design and online, of course, training, and we have now made a box system, which is actually traveling through a few people, so they can actually test the technology, because normally we would do it in our university. That's not possible. So everyone does it at his own terms and in his own house.
Okay, I think that's well. I have a last question, just 1 more minute to answer it. How do you, as a new policy regarding this housing adaptation, or what's really your goal? Do you expect to have inputs from the the housing market and from the housing policy on this kind of housing adaptations?
Okay, that's a good question. That's actually where we are, what we are working on right now. We have developed a questionnaire to capture the needs of all stakeholders. So architects, building promoters, whoever is involved in building and renovating houses to age in place, we are capturing their needs and going to start up an awareness campaign for them specifically as well.
Okay. Well, I think these are all the questions that we have for the moment. There will be another session at the very end. If anyone wants to place any other questions, please go to the question tag on your screen and you can place them. And there will be other sessions, other question and answer sessions after each of the presentations. There's after the slots of presentations, so they are all welcome. Thank you. Thank you, Aline.
Okay, so let's go on with the workshop. As I have said, we are not going to launch yet the second poll. Let's try to see if more people joins us. And now we will go to the block of innovative solutions for housing support and health and well-being. There we will have 3 different presentations, and the first one is Tender Project that will be introduced by Anne-Laure. Anne-Laure Herman holds a master's degree in intercultural communication and translation by the University of Paris-Sorbonne. She joined the Visual and Telecommunication Applications Group at Universidad Politécnica de Madrid in January 2020. And the concept of tender is to include all the participants, patients, families, caregivers, and professionals in all the stages of development of the innovative ICT-supported integrated care solution. So when you want, you can start, Anne-Laure. Thank you. We cannot listen to you, Anne-Laure.
No. Go on. Should be okay now.
Okay.
Can you not hear me?
Yeah, now we can hear you. No.
No.
No, we can see your slide.
Can you hear me?
Yes, we can hear you.
Yes. Yeah. You can put full screen.
Ah, perfect. Fine. Okay. Okay. You can also see my screen.
Yes. Yes.
Okay. So now I go. Okay, can you? Then I start. So our project, which is sorry. Okay, good. It's called age 2020 project, and it's started in last November. Tender for we already said, working for advances of the main for the topic large scale pilot.
Sorry, Anne-Laure, I think we are having some problems with your sound.
Yes, I would suggest, Sylvia, that we move to the next presentation, and then in the meantime, I'll try to explain to Anne-Laure how to change the audio connection. She will probably join by phone. Okay?
Okay, so Anne-Laure, Regis will yeah, because we cannot listen to you. It goes like jumping. Yeah, I think that we will now give the floor.
Here, it's an innovation.
Yeah, this is the
action.
Yeah, I think now till we try to solve these technical issues that always happen when you have these events in direct, we will give the floor to Charis Charalam. Sorry, Charis Vassiliou. He's the project coordinator of a Smart Work project, and he received his BCC in Computer Science for University of London, and his master in computation for University of Oxford. He has been scientific and technical advisor for various agencies and companies in the private and public sector, including Intrasoft International, Athens Chamber of Commerce and Industry, National Confederation of Hellenic Commerce, Hellenic Copyright Organization, and others in information systems, web application, and new technologies with respect to various business and research domains. He has been active in various research fields and has undertaken more than 50 European and national projects in diverse areas. And well, as I have said, he's the lead project manager and coordinator of Smart Work project. So when you want.
Thank you, Sylvia. Just making sure my presentation and my audio is fine. Can you hear me well?
Perfect. Yes.
Great. Thanks, Sylvia, for that very nice and warm introduction. And I'm really happy to be part of this panel today and the workshop with such interesting projects. So due to time restrictions, I'm going to go straight into what Smart Work is and generally our story behind the project. So in principle, what Smart Work project is, we're trying to building a worker-centric artificial intelligence system with the aim of sustaining the workability of elders in trying to integrate unobtrusive sensing devices and a modeling framework to model the worker state. And by combining these, provide actually a suite of quite innovative and novel services for the context of the worker in terms of supporting him on his working and living conditions. In generally, we aim to design basically and create age-friendly living and working spaces based on artificial intelligence technology. Our main challenge, we started off this idea behind focusing on the fact that workers between the age of 55 and 65 that wish to maintain an active professional life and obviously an independent living as such needed to have support due to the various issues that affect their everyday life, such as the overall aging process, some potential functional limitations, different health conditions that can be deteriorated, and different care needs, obviously, that all these combined can obviously affect their professional life as well as their everyday living. So our objectives were four main objectives for the project. And obviously the first one was to create the AI-based worker-centric platform to sustain the workability of the elderly. to achieve, to a certain extent, an non-obtrusive sensing framework based on different sensors that will not interfere as much as possible with everyday life of the elderly worker, in order to create a model of the worker's state, to implement different services that I'm going to show you later on, and to obviously evaluate and validate this whole approach through 2 different pilots, focusing also on issues about ethics, privacy, and security. So doing the actual piloting in real world settings, real environment, with the focus on these aspects. So which are our target groups? So obviously our primary target group is the office worker between 55 and 65, which provides continuous monitoring and risk assessment of their health status, their potential functional and cognitive capacity, and so on. But we also focus on 2 other important roles in this cycle, in this ecosystem. We have the employer, which is also empowering the system in terms to improve the efficiency and the productivity of the office worker, and obviously the teams that this employer is monitoring, and the carer that gets information about the overall health status of the person they care, in order to provide more tailor-made caring services. So the key features behind our services: we wanted to offer a suite of different services using primarily artificial intelligence to support the office workers. We wanted to have to monitor the health, the behavior, and the overall cognitive and emotional status of these workers, to support them in their daily activities, primarily in the work environment, as well as during their everyday living quarters, to deliver the benefits for these older workers, their employers, and the carers, and so on, based on the elements above, and to validate these pilots, the system through the real-world pilot sites in CDC in Coimbra, Portugal, as well as in the municipality of Aarhus in Denmark. We concluded in these services as the core elements of smart work that are divided between the 3 different actors, the 3 different stakeholders that I mentioned. So we have the Healthy.me application, which delivers precise monitoring of physiological and behavior parameters, and it's focusing directly on the elderly person, on the office worker. We have the workability service that's primarily measuring the psychological and physical capacity of the worker itself, in order to support decisions and improve their well-being in the work environment. UB Work, which helps the workers maintain a balance between the work environment and living quarters, as I mentioned before, by providing solutions in a unified environment between work and also their everyday house. And Work Coach, which primarily involves the elderly, trains them further, and provides personalized training solutions. We also have, for the employer now, the DigiTeam service, which takes information from the system and provides suggestions in order to improve productivity and improve the teams in which both elderly workers as well as younger workers can be coexist. And finally, the iCare service, which is a service based on the care, collecting all the information also from the Healthy.me application and all the other information from the office worker, and being able to monitoring and sort of tailor the caring services provided to the best possible extent. This is a very high-level architecture view, just for a way to show you how the 2 frameworks, the sensing framework and the worker-centric AI framework, are combined and relatively entwined in order to offer the different services that I mentioned before. And we have a list of important impacts for all these different roles, and also extending those roles further in terms of the impact. So we have impact which is foreseen for the older office worker, which is our primary and main contact stakeholder, improve their quality of life. There are different socioeconomic benefits for them, enhanced health and safety at work, and obviously involve the independent living. For the employers, we have an improved human resources management and as well as productivity between the teams that work into the office. For the carers, the monitoring, which is a continuous real-time monitoring aspect, providing better risk assessment and also better recommendations as such. And our later, let's say, actors that have foreseen benefits, which are the health care systems, the overall scientific community, and the society, with different elements of impact that are derived from the previous main core roles and services offered by Smart Work. As I mentioned before, we have two pilots. We have a pilot that is aimed in CDC in Coimbra, Portugal, and then another one that will be fostered by the municipality of Aarhus in Denmark, in order to assist us and help us in co-creating and evaluating the overall Smart Work system. The different phases that we've seen in the project is basically phase number one, which are the user needs and requirement analysis, quite an important task to understand the real needs behind our main stakeholders, primarily the elders as well as the employers and the carers. We had online questionnaires and interviews as well as focus groups on our different pilot sites. And these have proved very useful in terms of providing really important material in terms of functionality, ethical and safety issues, and so on. On the phase two, which we are currently at, we're looking at the trial operation of the first prototype in the semi-controlled environments. So we're looking at the semi-controlled initial trial, which is going to take place in Coimbra in Portugal. The duration is estimated for 2 months, and we have a limited set of people involved, around 12 older office workers, 2 managers, and 2 carers. And we aim to collect information about the system in its initial phase, get feedback, get some initial data collected, and also try to feed that outcome into the enhancement of the system and producing the later evolved Smart Work system and services. Going then into our phase 3 of the project, which is the final field trials with the end users in a much larger scale, real-time conditions towards the end of the project, which around 6 months duration. Both pilot sites are going to take place here. We're looking at Coimbra in Portugal again and Aarhus in Denmark, with around 60 office workers this time, which is a larger amount of people involved. Very quickly, some main highlights until this point. We have produced quite an enhanced SOTA analysis and gap analysis at the early stages of the project. As I mentioned before, the user requirements phase was an important one. We did an analysis of the user needs. We looked deeply into the data collection framework and data collection process, as well as the intervention strategy we wanted to follow, and design the overall system architecture. We deployed the overall unobtrusive sensing infrastructure, which has been quite an important step for the project. We looked at an intelligent mouse that collects information from workers as they work, well, sleep and activity trackers, intelligent weight scale information, environmental sensing to be combined with all the previous information, as well as ECG. And we implemented a low-level processing infrastructure, as well as the data security and privacy elements. We went into the data ontology, and then we developed a cognitive modeling algorithm. We defined the workability framework, which had an important research aspect behind it, as well as the work and personalized on personalized and predictive models, which haven't been tackled per se before, and produce some really interesting also research outcomes. And then we developed the user interface through different rounds of interactions with the end users. The streamlined user interface of the overall system using Morphic, as well as different sets of interfaces for different devices, such as the smartphone, the web application, and so on, because certain services are provided through different devices. For the part about the DIGI team, the services that I mentioned before, on the aspect of the employer, we had an all-important Trello Power Up module. We didn't want to reinvent the wheel. We wanted to produce a tool that can be embedded in everyday activities on organizing work and organizing teams at the office. We implemented the team management features and also started on the implementation of the training prioritization module, looking into the gaps of the trainers, looking on the gaps of the people working in the teams, and producing suggestions on where these people can be trained to evolve the knowledge, skills, and know-how. With the certain integration activities, we acquired the ethical approvals, which have been really important in this type of health projects. And then we also have several dissemination activities and exploitations of the project so far, since we are around the middle of the project. We had several challenges, obviously, as every project does, in terms of the user engagement, both in the process of getting requirements as well as in the actual pilots, adapting the different AI-based solutions on the new models that we provided and we created through smart work. And then obviously COVID-19 imposed many challenges on the way we work and the way we should run the project and the pilots. We are at the phase of the pre-piloting, as I mentioned before, and we are looking forward for getting all the feedback and trying to do corrective actions on the existing implementation. We have the pleasure of coordinating a very nice and a very professional and productive consortium of 10 different expert organizations from different fields, from 8 different countries, from ICT industry, academia, research, as well as public and non-profit organizations. This is our group of partners involved in the project. And then the project coordinator is Byte. I'm happy to coordinate this project, as well as the dissemination coordinator, Carolina from ECH Alliance. I guess we can go into different questions later on. I'll just give you here the information about where you can find more information about our project. And I hope I'm on time, and this concludes my presentation. Thank you very much.
Yes, thank you very much. You are perfectly on time. Thank
Great.
you. Now we will go on with the other projects, and in the end of this block, we will have a questions slot. So now we will try again with Anne-Laure Herman with Tender Project. Let's see if it works now. Anne-Laure, are you there? No?
Yes, hi, I'm here. Can you hear me?
Hello. Yes. Yeah.
Okay, great. Sorry, I hope now that my connection is better. I guess. Yeah. Okay, so can you see my screen?
Yes, we can see your screen, and you should put it in a full screen mode, please.
Yeah. Okay. Then I will. Let's have another try. Sorry for the technical problems before. So I will start from the beginning right again. So I will present today the project Tender, which is an acronym for Effective-Based Integrated Care for Better Quality of Life. It's an age 2020 program, and it started last November. So we are in the first third of the project, and I'm happy to present it today. Thank you very much for the invitation. As I said, the topic is the large-scale pilots of personalized and outcome-based integrated care. It's an innovation action, and UPM, Universidad Politécnica de Madrid, is coordinating it. So with my team, we are delighted to answer to some more questions. Don't hesitate to contact us. As I said, our project started on November 1st, 2019. So now we are in the first third of the project. It will last 3 years at all. We are 13 partners from 7 different countries. We want to enroll about 1,500 patients in our 5 research pilots, which will start in January 2021. So now the question is, who are we? We are Universidad Politécnica de Madrid is the coordinator. Then we have several members from the industry and also from the end user side and from the policy organization. If you have any questions to some entities in particular, don't hesitate. It's my pleasure to present them more in detail. So here's a little map of our dear Europe. So I'm based in Madrid. We have 2 other partners that are also based in Spain, 1 that is in Portugal, 2 that are in Belgium, 1 in Germany, 3 in Italy. Then we have 2 in Slovenia and 1 in Greece. So we're kind of everywhere, and we really hope that our next project meeting will finally take place in real, hopefully soon in Greece. We all want some sun and some real people after this strange period that we hope to finish soon. So I will go back to Tender now. Why have we created Tender? So the problems is that there are around 10 million people already living with Alzheimer and other forms of dementia in whole Europe, and this number will be doubled by 2030. And let's say our project is focused on neurodegenerative diseases in general, so we don't focus only on Alzheimer's but also on Parkinson's disease. That will also raise a lot in the numbers. Then how to describe Tender? It's a project which will help people to live more autonomously in their home environments, but also in care centers, rehabilitation centers, and in the hospital. So we want to be, our aim is to be that they are more independent and also to relieve the burden from the health professionals. So here you can see our objectives. So we want to detect their activity, their health status, and also their emotional status. This is one of our current challenges, how to detect emotional status with artificial intelligence. We want to, of course, ensure the secure data processing and sharing. We are always complying with the GDPR. We want to improve the quality of life of the patients and their family, as well as I already mentioned, to improve the working conditions of the health professionals and the care providers. But this can also be, here we distinguish between formal caregivers and informal caregivers. So of course, any family or friend is also targeted here. We want to build our platform as an open and service-oriented architecture. Here, always the user is in the center of the development. It should be an information-driven ecosystem, and this goes in the same direction. We want to follow a really co-creation process. So what we are doing currently is to gather the requirements of the users and develop the system according to their needs. As I said, it should be a collaboration among the technical and the end users. We want also to generate impact and to create new business and job opportunities. And of course, one of our objectives is really to conduct these pilots, and we hope that they can start in January 2021. So how will it work? it's a combination of the user-friendly technologies and the research experience that is already existing. So basically, we use some micro tools that will recognize the mood of the person and track the basic vitals, so as blood pressure, heart rate, and others. And then we will match this information with their, let's say, profile to see, okay, is it normal if this patient is sleeping during the day or not? And if it's not normal, then an alert will be sent. And so one of our aims is to improve and to make the communication smoother between the different healthcare providers. We have stated that the big problem in the care sector is the communication, and this is something we want to improve. As I said, we have also some legal and ethical experts among our consortium, so it's always ensured that the personal data is GDPR compliant, the data handling, let's say. So I want to give a brief technical overview. Here you can see a little picture to imagine how Tender looks like. So we have 7 services, let's say, in our structure. There is this monitoring, warning, and reporting with the different, let's say, tools that you can see. It can be some sensors and cameras. The cameras will, of course, not detect the person's face. It's just cameras that detect the, let's say, a skeleton structure of the person. And eventually it can also detect the facial state. I will come more into detail to this after. So then the next service is the social services. So what we understand hereby is, for example, the Tender wants to offer to patients that they can be reminded of their medical appointments that they have, that they adhere to their drug treatment, that they take all their pills and medicaments. We want to track their quality of sleep. We work with a sleep pad that is fixed to their bed to track their sleep quality. Then we want to track their emotional state. So we want to figure out with artificial intelligence to see if someone is aggressive, sad, happy, angry, maybe anxious, to see what's the emotional state. We also use a localization service, fall detection. We have, in fact, Tender is based on a previous European project that was called ICT for Life, where the fall detection was a big topic, and now we want to further develop it. So the issue is here that we want to kind of predict if someone is going to fall soon, if he has some abnormal movements and behaviors. And this is also included in Tender. And for the home scenario, we also want to check some other, let's say, variables like the temperature and the humidity to improve his quality of life. So I will maybe not go more into detail about the technical background now for the lack of time, but as I said, we want to start our pilots in January 2021. They will take place there will be 2 pilots in Madrid, 1 pilot in Rome, 1 in Ljubljana in Slovenia, and 1 in Bavaria in Germany. So what's like the footprint that we want to leave on the planet with Tender is we want to ensure the user's trust. We want to empower the citizens that will use our system, and of course, behind this is the maximization of the potential of digital tools. I hope this was clear. So far, I'm open for questions, and thank you very much for your attention. Don't hesitate to check out our website, tender-health.eu. We are also on Twitter and on LinkedIn. Thank you very much for your attention.
Thank you very much, Anne-Laure. Now we will go with the next speaker that will present us Pharaon project. Professor Filippo Cavallo is Associate Professor in Biomedical Robotics at the University of Florence in the Department of Industrial Engineering. His research interests include social robotics, human-robot interaction, wearable sensors, Internet of Things, and artificial intelligence for robot companion and healthcare applications. So please, Filippo, the floor is yours. When you want, you can jump.
Thank you. Can you hear me? Can you hear and see me?
Yeah.
Okay. Yes. Just 1 second. I'm going to share my. Can you see my screen now?
Yes, but you have to put it in full screen.
Okay.
Yeah.
Okay. Fantastic. Okay. Thank you very much for this invitation. It's a very pleasure to be here, and I found very interesting this combination of contents which are related to the sustainable housing, and I think it's a very interesting field where we can share our experience in new projects, in new developments, and also in the deployment. And here with the Pharaon project, I'm going to present one of our last activities, which we are carrying out, which is a project, an European project concerning large-scale deployment. Particularly here we are talking about pilots for healthy and active aging. Just a few words about this project, just to give you some information that probably could be also useful for you for future collaboration, because this project includes also cascade calls that will be announced at the end of this year or beginning of the next year. So maybe there could be also room for collaboration and for seeing you joining our consortium for possible additional deployment. This is a very huge project with basically was started just more or less 1 year ago. Even if with some, let's say, issues related to the COVID situation, we are proceeding towards the objective of the project. So at the moment we are just preparing the first deployment of our pilots that in a while I'm going to show you. The Pharaon consortium is a very huge consortium with several partners, as you can see here. But thanks to this number of partners and thanks to this heterogeneity of background, but also of different countries from Europe that are part of this project, actually we are developing 6 complex pilot sites in Europe, each of them which have a specific distinctive features which are related to the needs that old adult people have in their territory, basically. So actually the idea that is behind this project in general is basically to find the way to integrate, really integrate and truly integrate digital services, devices and tools in order to foster and to facilitate the deployment of specific services for active and healthy aging, and by using let's say most of the contents that comes from the digital transformation, or if you like digital transformation or innovation in healthcare. So with the use of elements related to the artificial intelligence, Internet of Things, robotics, and blah blah blah. And this is one of the key, let's say, issue of this project. Another challenge that I have to make, I have to highlight in this large-scale pilot project is the methodology that we are following to foster and to really go towards a truly unbelievable, let's say, deployment. So we are pursuing co-creation agile methodologies in which we started from the user needs, and from that we are now just defining and consolidating service model with specific linked technologies that will be then used in the deployment. As I said, we have a big budget. Let's say big, depends on what you think, if 3 million euros are enough or not for as a budget. But the idea is to use 3 million euros of budget to really open and extend our platform, our platform of technologies and also services to external partners that can really contribute in the deployment and really reach a good, let's say, use of the technologies and in this context, so in the active and healthy aging. Here you can see the main pilots, the 6 pilots that we have. We aim to reach a high number of users, and we are also developing a specific evaluation methodology to understand and to really estimate the impact that this could have at in Europe, but, which is really important, also considering the last situation due to the COVID. And here, as I said before, the heterogeneity of these pilots enable us to address a different domain, not only related strictly to the healthcare, but also to transport and mobility, energy optimization, and smart cities. So I would say that this project has several overlaps, let's say positive overlaps, with the topic of this conference where we are, and looking also at the previous presentations. Actually, there are a lot of aspects that could be considered for piloting, also from your point of view, basically. Here there is let's say an aggregated scheme of what are the main challenges in terms of services, in terms of support and action for active and healthy aging, and how they are distributed in the pilot site. I don't want to go too much in detail on this part because it will be too much technical, but I want to just put your attention on the 10 challenges that we are trying to face and we are trying to deploy in during the next year, basically. So all the challenge, it's interesting to see that cover different fields, from the more assistive services to the more, let's say, also clinical services. So something that could be related also much more to the remote or domiciliary monitoring or support in specific chronic disease, but also to the possibility to be integrated in the society, because actually in the end also services like mobility and integration, so with the services that are in the society are quite important, and in some way are not independent of the good quality of life at home or the good health status of the patient. So all of them are integrated, of course, and are mutually coupled between them. So you can see here the list and how this is a really variegated aspects of the shape of the services that can be performed. Where we are now, we have in terms of project, we have just finished the analysis of the user requirement, actually a couple of months ago, in which we tried to go really in detail in what are the needs of the users, but also the kind of how to transform and how to shape these needs in specific services that could be truly deployable. And the interesting point of this methodology was also to consider different aspects in this analysis, which was also an emotional that included also emotional content, let's say. So which was related to what really users and let's say maybe not users, stakeholders, primary or secondary stakeholders in some way, not only end users but also family members and also non-professional caregiver, and as well also professional caregivers, service models, what they perceive on the goodness of this approach and how this could positively, let's say, make them feeling better in this context. So this basically is an example that was developed and was investigated by each single pilot, and here I'm just presenting the methodology, which then is linked to the 10 challenges that I showed just before. I have to say that on the basis of these, we are now starting to shape concretely the pilots in terms of recruitment, in terms of installation of the technologies, and in terms of above all of defining a specific platform. When I say platform now, I think something which has a substantial technological value, which enable, let's say, the pilots at pilot level, but also at a more higher level, to be interoperable, to be standardized in order to easily exchange data or to easily share devices or methodologies. And this is basically the topic on which we are just working now. So the idea is to produce I have to say, we have today the deadline of a deliverable, the initial status of the Pharaon platform, and on the basis of which we will then try to facilitate the integration of the services. Of course, this big platform will be not fixed, but will evolve along the entire project. I would say that the pilot is a very nice. The pilot has been from the beginning of the project a very nice environment where to work together and also in a very multidisciplinary way. I'm going to show just very quickly also the experience that the COVID situation in some way generated. And I'm going just to show you a very quick, example, or if you like, experience that we had in the Italian pilot. I will present only the Italian pilot in this case because it's just closer to me, but actually I can say the same for other pilots like in Spain and so on, which had also similar experience when coping with the COVID situation. But the COVID situation in some way really fostered something new, so something to, let's say, let's keep our arm and let's do things well. So this is actually I would like to say the spirit that the pilots should have, and we like to propose this. So also to find countermeasures to the COVID situation. For example, we started soon to pilot some solutions at the pilot level, and it was interesting how to work together and in a very fast way in that case to solve several issues which were related not only to the technology, but not only to the standardization and blah blah blah, but also to the ethical issues, to the social issues, to the legal issues, and also to the capability to integrate the services in the normal work of the caregiver that of course they had, because it's typical to say when you have to integrate a technology in a normal process of care, it's by default difficult because everybody is fixed on their process, on their kind of work. And this is true also at home, particularly when you go at home to provide support at home, assistance and blah, blah, blah. So integrated this technology can often represent a sort of shock for who has to be, for what is working on that. Imagine this in a COVID situation where everybody was crazy because of the situation. Everybody was running. Everybody was also afraid on the situation, on the own health situation related to the virus. Okay, so it was very interesting, and this experience. And in the end, I have to say that in a couple of months, also less, I have to say, we were able in Italy to define three scenarios particularly, which was related to the monitoring at home of patients or elder or old adult at risk of COVID, or let's say after COVID diagnosis in the next phase after the hospital phase, basically. So it was a remote monitoring that was really important in order to avoid the connection and touching and people to avoid basically people that could transmit the virus. Basically, this was done in one of our pilot sites in the south of Italy, in one hospital which is part of the pilot, as well as in care facilities in Tuscany. Instead, we worked a lot in telemedicine, in teleassistance, and we have also been using a couple of telepresence robots, and we have also ordered 3 new robots. So this is interesting because we are just trying to push much more some technologies that maybe 6 months ago were a little bit not so easy to integrate in the normal use. And also we have also faced very quickly with other partners of the FARON project the quick development and deployment of sanification robots for this situation, which could be really an interesting opportunity to cope with the virus and to cope with assistance and active and healthy aging. Okay, so that's let's say the experience that I wanted to show you in first presentation of the project, which let's say it's in the first year, so we don't have specific big results in terms of impact, but we are preparing them. On the other side, I like to show you how let's say eclectic and speedy could be the pilots. And by the way, this last but not least, the invitation for you to follow us, because we will have some cascade calls and we will be happy if you can join our consortium. Thank you. I hope to be on time.
Thank you very much. Now we will have a slot for questions and answers for these 3 projects, for a Smart World project, for Tender project, and for FARON project. So please, Olat.
Yes. Well, I think that Filippo already answered this question, and I think then I will place it to Yaris and Lore. It's regarding about the impact of the COVID on your projects. Not that much on terms of how the delays of the activities, but as Filippo has explained, he already answered this question. In terms of how you have to rethink the objectives of the project, the strategy, and what way they improved also your expectations of the projects. Yaris, could you go on first and then
I was about to give the floor to the lady first, so it's okay. It's okay. Okay, I'll briefly say a few things about that. Indeed, that is very interesting, and particularly in our project, because we have to do with the work environment primarily. It has also another big role. Well, obviously, the first impact was the fact that we had to see how we would adapt our pilots in order to receive the data that we wanted and to take into consideration the fact that we didn't have all the time the real-time aspect of the working environment in place with people working on the same location. So this is something we have to think of, obviously, for the pilots, which is the phase we're going through now. But at the same time, it was a positive effect in the sense that we are now also looking into aspects about how the teleworking part is also, affecting the services of smart work. So we have the different services also in terms of the DigiTeam part, where you can see how the teams work. And now we have a new aspect, which is teams working remotely. So this element is also quite important. Plus, a really interesting outcome is the fact that quite recently, in collaboration with other 6 projects funded by the European Union under the same call, we had a concerted paper between these different partners and the different projects regarding the role of artificial intelligence technology in working through COVID and the overall aftermath. And it's quite an interesting read that you can find on our webpage, as well as the European Commission portal on results. So that will be an interesting element to go through.
Okay, Anne-Laure, can you answer the question? I don't know if is she in? Maybe we lost her. Well, no. Well, maybe we have another question then. It will be this time. It will be for Filippo. Well, I've seen that. We'll see that you have lots of public entities involved in the project already. You have a huge consortium, and how do you expect those that this platform will? What kind of public administration support do you think that it will have further beyond the project duration?
Do you think the support from the public administration or for the public administration, or both?
From the public administration.
From?
Well,
yeah. Okay. That's a nice question.
and also, at what scale are you expecting that? I mean, is it only at the city level, or is it regional level?
No. Yes, absolutely. It has to be also at the regional level, also at the rural areas above all, because it's more easy to have, let's say, smart city services. It's more easy to deploy them, but also in Italy we experienced a lot of issues related to old people living in rural areas or in mountain, where it's not possible to, during the COVID, when we had the lockdown, most of these persons were in a lot of difficulties, not because of the COVID per se, but because they had other disease and they could not receive any assistance or medical support because of the COVID, because of the lockdown, let's say, constrained too much person to not go to the hospital, not to go to the family doctor, and blah blah blah. So absolutely, the idea is to really have a pervasive distribution of this kind of services. Concerning your question, which is really important, and I hope maybe to be exhaustive now, but probably the experience with Faron will make it more mature. My answer more mature in the next years, let's say, is that from the public administration, it's really required a new way to think, to cope with these issues, because there are too many aspects that should be simplified, and many processes that should be considered. So it's important to integrate these services and in what are the true services to the community. Let me try to explain better. The public administrations and the public services in general should start to be faster in change things, in innovate and in evolve. Maybe I'm not saying nothing new for you, but I think that this is a crucial way. With the COVID, I think that at least most key persons changed a bit their mind, I have to say. And I can feel it as a clear experience in Italy, because most of the prejudice using technology, I think that were overcome. And it was more easy to talk with some persons on the adoption, for example, of a telepresence robot. Until 6 months ago, when I talked about telepresence robot, it was really a nightmare for me. So what's that? No human connection, we are losing the human. Yes, okay, the technology is a bit more cold than the human, but it's not only the unique thing. So I think there is more flexibility in shape the world as best as it could be for us. It's not a unique sense for that. So in that direction, I think that with the COVID, we really experienced the good value that the technology could have. Of course, taking in consideration the risk, because I'm the first person to say, let's avoid isolation due to the technology, because it's maybe a bigger problem than what we had before. Another point I want to add is that basically also the users are happy to have the technology, because most of them were scared about COVID. And thinking about the way to have a tablet or a sensors to avoid to go to the medical doctor, to avoid to go to the hospital, but to simplify the provision of services was really, really good. And also the end users understand better this point, which is third point. I think that also at the policy maker level, probably are thinking much more the possibility to integrate teleassistance, telemedicine in a more professional way, not only on a scheme that we found on our nice slides. So really now what is needed from the public administration is that the healthcare body are able to officialize also in the catalog of the technologies, in the catalog of services and blah, 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 the possibility to have this technology also in terms of reimbursement, in terms of provision to the users. So this is a big step that probably the public administration should do now, and simplify, of course, some other processes. I'm thinking about ethical approval or some, maybe this, you know that. And also in terms of responsibility, who is going to sign that we can bring our sensors at home? Someone has to sign, has to take the responsibility. So this should be done now, because the technology we have been using in the pilots, it's the same technology we are talking about in the last 10 years. For me, it was nothing new as a technologist, but as was and providers, it was a lot. It was a big. It's coming to be a big jump. Sorry, if I log. It's a very interesting topic. This, I think. So it's nice to talk about it.
I have a question for Harris, although I am not supposed to be asking, but we will do it like a kind of meeting among colleagues. When you talk about the smart work, you are focused on this age group between 55 and 65, but don't you think that probably that project could be extended to all the age groups? Because well, we are experiencing now with the COVID situation what is to telework. Although Olatz and myself, we are today at the office, but I can see that most of you are at home because that's the situation we have nowadays. And it's already clear that it will have some consequences in our physical and also mental health. So don't you think that all the things that you are developing will be also extended to all the age groups?
Yeah, that's a very good question, Silvia. I think, of course, this is quite an interesting aspect of the things we're developing, and in the course of the project, we've seen this as well. Definitely, the main, stakeholders, as I mentioned, are the elderly, and adapting these services for this new era would require obviously modifications on the model that we have in order to put more emphasis on the elements related to general psychological and physical fatigue or impact to all ages, rather than taking into consideration just the aspects of the elderly. So I think it's like a subset of the things that we developed in the model that could be applied in order to develop some new type of services for this new situation that we're facing, for sure. The logic behind it is definitely something usable.
Yeah, okay. So we will, and when you talk about older people, when they are 55 plus, I am getting more and more upset about that.
I don't like that age.
We are closer and closer, and
getting too close to that age.
All of us. All of us. I'm sorry for that.
Thank you very much. We will have now a 10-minute break so that you can go and take a coffee or anything, and we are back here in 10 minutes. So at 10 to 11, please. And for the audience, start thinking questions, because if not, we are going to have like a kind of dinner here among us. So thank you very much. See you later.
See you.
Thank you so much.
Thanks.
Thank you.
Well, if everyone is on board, I think that we can go on with the session. Now it's my turn. I will start with a blog called Support and Investment into an Implementation of Age-Friendly Housing. And well, I am Silvia Urra. I am chairing the workshop, but I am also the coordinator of Homes for Life project. That is a Horizon 2020 project, and I am an architect as a background, and I work in Technalia research and innovation as researcher, and I have been more than 10 years working in projects related with adaptation of the living environments and the cities to the needs of an aging population. So I will. Yeah, you can see my screen.
Yeah.
Okay, so well, Homes for Life, as I have said, is an Horizon 2020 project. It started in December 2018. It was supposed to finish this year in November, but due to the COVID, we have an extension of 3 months. So we will finish in February this year. And it's a very interesting project because it has, among the partners, we have a lot of different profiles. And I think that that's one of the more interesting things we have, because the points of view that all of us are putting in the project are different. We are two technological centers, Technalia and the TNO, well, Technalia from Spain and TNO from the Netherlands. We have also two different universities, Utrecht University and the Department of Science, and from Italy, La Università Politecnica delle Marche. We have two private companies, Certibea, that is a certification body that develops and commercializes certification schemes, and R2M Solution, that well, you all know R2M Solution. And we have three associations, the ECTP, that is the European Construction Technological Platform, Edge Platform Europe, that is the platform that englobes the biggest group of all the adults associations across Europe, and Eurocares, that is an association that represents informal cares. So as you can see, we have very different profiles that have been very interesting to have on board. We are in the project, what our aim is to develop a vision and to define what is the concept of homes for life. We did select the word home and not house, even if in today's workshop we are talking about housing, but we always say home because a home goes farther than the house, because the house is the physical space where you live, but a home is something that is also the place where you develop the project of your life, where you have relation with your community, with your family and friends. In the end, a home it goes farther than the physical space. So to develop this vision about homes for life, we did also at the first stages, we did work on the establishing what was the context regarding age-friendly housing in different European countries. And we also did analysis of different innovative solutions across Europe to see what was going on in Europe in this field. And we saw different situations depending the different context. And so with that, we did develop our vision for 2040. Well, Homes for Life vision is, sorry, I lost. Imagine a society where your house is truly your home, a supportive, enabling environment that helps you realize your full personal and social potential. Imagine a society where such houses are within reach for Europeans of all ages, regardless of income, gender, race, or ethnic background, sexual orientation, health status, or disability. This is the vision we support for 2040, and we invite all of you to join our vision. And we have seen that when we talk about age-friendly housing or homes for all life course, it must be a key public policy, and it must be based on 3 elements. First of them is that all relevant stakeholders, construction sector, public authorities, ICT and care service providers, financial sectors, and the owners of the homes must be aware of the benefits of age-friendly housing and have been ready to implement an age-friendly housing strategy. There must be appropriate tools and policy frameworks, regulatory legal frameworks, housing stock structure and ownership, and housing governance. And of course, the economic part. All stakeholders need incentives appropriate to their needs and concerns, grants and tax credit reduction for retrofitting and new age-friendly houses. What are the factors that influence the development of age-friendly housing in some countries and in other countries? There are some factors that are enabling or facilitators: the existence of a regulatory framework, the existence of know-how, the existence of financial incentives, the structure of the housing stock, and, to be clear, responsibilities. If someone is in charge of planning the future demand, there is a specific institution that is designated to deliver and to fulfill the housing needs, it's going to be more easy to foster this kind of initiatives around age-friendly housing. Which ones are the obstacles? When there is not a regulatory framework, when there is no know-how or is very limited, where there is little or no financial incentives, when the housing stock is totally private, because the responsibility of adapting the homes then falls into the owners, the individuals. And when there are not clear responsibilities, when there is no one at the administration level that is in charge of taking care of the future needs of the population. So we have seen that there is a growing need for age-friendly housing in North Europe, but it goes to different, it has different, let's say, profile depending on the structure of the housing market, the projected housing shortage, and the urgency in the levels of adoption. And there are also various maturity levels. It depends on the awareness of the issue, the range of good practices to age in place, the range of resilient housing options, the structural operational readiness for change, and the financial capacity to make the shift. So a tailored approach is needed depending also on the countries. What we did was also to define the concept of what was a home for all life course. So when we were defining this concept, we did develop a taxonomy. We made a classification depending on the different groups of requirements, and we did define some KPIs. And with all that information, we are developing a Homes for Life certification scheme, because we want to give people and administrations the tools to really have like a tangible result to certify if your home or your project is Homes for Life. So the principles of Homes for Life certification scheme, we have two building types. It's focused on residential buildings, and they can be individual or collective, and also their immediate environment, because as we have said, we are not talking just about the dwelling, we are talking about the home. So the immediate environment is part of that home. So we have like two different building types. One is the individual house, single and semi-detached house containing only one dwelling unit, and a collective building with multi-story building with multiple flats and different family groups, let's say. We also will assess for different perimeters. It can be a single house, it can be a single flat in a collective building, it can be a single whole collective building, or it can be a residential complex where you have different buildings and different common spaces and equipments. Also, we are defining two different building situations. Well, this certification scheme is continuously changing because we are now developing it and we are testing it, as I will tell you later. So perhaps if you have listened to any other presentation of Homes for Life, you will see that some things are changing, but well, that's the way it has to be. So we are defining two different building situations. One is when the building is not in use yet. So it's in the same phase, it's under construction or delivered, but not in use yet. And this includes not just the new construction, but also retrofitting, renovation, and rehabilitation. And we have the other situation that is in use, that is the building exists, has been officially authorized to be occupied, and it's occupied. So the certifications project will be like, if the building is not in use yet, you will go for a documentary verification in design phase. At the end of the design phase, then another on-site audit in the end of the works of the project, when the works are already finished, and then you will have other verifications in the operation part of the building. This is also has to be really close because we are working on that. Also, we are defining the validity of the certificate, and well, we are trying to close some things with the inputs from the pilot cases. The structure of the certification scheme, well, I don't know if you have, if you are used to use to employ in different certification schemes, is similar to the other ones that already are in the market. We had quite clear from the beginning that we were not going to start doing things that were already done. So when we started when we started working in the taxonomy and defining the KPIs, we did really research about the different existing certification schemes, and we saw that there are a lot of work done in things around physical and outdoor access, like things related with accessibility, with comfort, indoor air quality, things more regarding related with health and well-being. And also access to the exterior of the building and so on. But we did find that there were very little things done around other things, like the ones that have more to do with the personal, with the feeling that you have when you are in your home, with the social, how your home can help you to keep on being part of the community, and also with the economic part, that was affordability and the choice. So we did work in that part, and we defined 5 different clusters, and that is how the certification scheme has been organized. We have 5 different clusters and another one that is management, but the technical clusters are personal, social, economic, physical, and outdoor access. And inside all of each of them, we have like some categories. In personal, we have identity and emotional connectivity, privacy and dignity. In the social one, we have social activity and employment. In the economic one, we have affordability and choice. In the physical one, we have personal safety, comfort, accessibility and orientation, health and social care, and smart readiness. And in outdoor access, we have home and building, immediate environment, and neighborhood or village. And the way we test all these different clusters is by requirement or surveys, if they are applicable. So as I have said, we have 5 clusters, 14 categories, and 59 subcategories. And then we have surveys and we have requirements. The surveys, of course, if the project is in design phase, it's going to be difficult to know who should reply to the surveys if you don't have already identified who is going to be, who will be the residents of the building. But if the project is in use, then you can go on and deliver the survey so that the people that is living inside this home can give their opinion about the different requirements they are asked for. When we go more for the share of the score per cluster, you may see that we have given much more weight to supercluster 1, that is personal, social, and economic, than supercluster 2. That's because in most of the cases, we consider that supercluster 2 may be already covered by the laws of the different countries. I mean, in most of the countries, at least when we are talking about new buildings and retrofitting, you have to comply with some accessibility laws and also habitability laws. So we consider that that's covered. But we have seen, as there is a big gap in the other clusters, we think that it's important that in our certification scheme we push for these personal, social, and economic clusters. And then let's say the scores are translated in different metals, like platinum, gold, silver, or bronze, depending on the percentage of the requirements, the points you get in the certification scheme. Well, the certification scheme, it was more or less, let's say, theoretically developed in the first year of the project, in January last year, more or less. And then we started with the testing phase. So we identified during the innovation analysis, when we were identifying different innovative projects across Europe, we did identify some of them that we thought could be interesting for the testing phase. So you may see that we have now 10, 11 pilots, because one in Bilbao still needs to be confirmed, in 4 different European areas. We are covering all building types. Some are public organizations, some are private, some are in design, and some are in operation. We did, in the first phase, we did test all the projects that were in design phase, and we got like some input, some feedbacks from the project managers. And with that, and that was done in spring 2020, in the first lockdown, let's say. And now we are going to start the second phase, where some of them have already been done and some will start soon. And this phase will be done in autumn 2020. So from the first phase, we got some inputs. We developed a version 1 of the certification scheme that it will be the one tested in the second phase. We have a call for comments next week, November 5. You can find the information in our webpage, because we would like to invite everyone to be there so that you can give us our inputs and we can accurate and develop a more a better version for the end of the project. So we invite you to attend this call for comments. We have also developed a Homes for Life certification scheme brochure where we explain the need for age-friendly housing, also the benefits, not just the benefits for the person that is living in the home, but also for the property developers, for health and social care providers, and for the homeowners. And we explain there the different clusters and also like different phases of the certification scheme itself, the evaluation, the certification, and the training. And here it's open so that we can include here the different companies that will commercialize the certification scheme. We have also a community of interest with more than 130 people. We would like to invite you to join us also. You will get information about the project and deliverables and different activities. And well, we have our webpage where you can find all the information of the project. We have our Twitter, and we have also our dissemination and communication manager, Regis, that is here. So if you want something, you can contact him. And well, I think that's all. So thank you, Sylvia.
Thank you, Sylvia.
And now I would like to go to the last block that is called Get Involved, Age-Friendly Housing, Networking and Clustering. And I would like to invite Karina Dantas. She is Innovation Director at Caritas Coimbra, Vice President, EU Covenant of Demographic Change, Coordinator of the Stakeholders Network on SAFE, Main Coordinator of Group D4 of the EIP of Active and Healthy Aging, Member of the Policy Committee of International Health Literacy Association, CEO and founder of Science to Europe, and expert reviewer for the European Commission, Eureka, and AT Digital. She has been working in health and care for over 20 years. It became clear that only a holistic approach that includes a joint approach on policy and funding can bring true process. So she will go across different projects that she's coordinating or participating, and she will give us a general, let's say, a speech about smart, healthy, age-friendly environments, policy, and implementation. So please, the floor is yours, Karina. Thank you.
Thank you. I hope you can hear me now, and I do hope you can see my screen, although I have lost it. So, so I'm not sure how to progress without seeing it. But let me see if I can find it. No, maybe not. Okay, at least you can see it, I understand. Yes, okay.
Yes, we can see it, yeah.
Okay, so thank you for the introduction. Thank you also for the invitation. It's very nice to see a lot of different faces and projects here, and for sure a lot of them in which we are also involved. So this is a bit of a holistic approach, and it's good to see that we have a lot of people directed in the same speech and in the same way of approaching things, because for sure that's the only way to move forward. So I'm here especially to introduce SAFE. SAFE is a stakeholders network that now comes across a different number of initiatives, but the main way to start is to explain a little bit how it was born, and it has a lot to do with everything we have been discussing today. So in 2017, we were discussing along the IP and several other initiatives that everyone agrees that it would be good if people age in their own homes, but we saw that there was maybe not enough alignment between ICT, technological development, with the building industry, and at the same time understanding how this can be put together to enhance health and care. And of course, we know that we still have a big and long pathway to go and integrate all of this. But the main reason why SHAFE was born was exactly to try to propose to have a common policy and a common funding structure around these 4 topics. So ICT, building environments, health, and social care. So we were very happy to have, well, a voluntary, but a stakeholders network approved by the European Commission in 2018. And during this time, we were able to gather around 160 organizations that thought that there could be some sense in trying to align all of these areas. And we delivered to the Commission and to the member states in the beginning of 2018 a joint statement and a framing paper around these areas. These were some of the organizations that supported the work. And the joint statement that we delivered had 5 main points to go ahead. So we understood that there was the need of having a shared vision around this topic. So not to think about social care or healthcare divided, or ICT just for the sake of digitalization, or even work on building environments but not the rest. It was necessary to have a shared vision, and it implied not only bringing together these 4 topics, but also bringing together the different realities in the different countries. So the idea was to have a vision for Europe as a whole. And for this, we understand it's quite a big dream. So for this, we saw 4 main areas that were needed. One was that there was more cooperation, and this means also having communication. So the part of the different stakeholders from the different areas of expertise, either scientific or business or end users, should be able to communicate as much as possible and to understand what each other is doing. So we really thought of networking as being a main aim of SHAFE. Of course, we can all communicate, cooperate, and be very happy about it, but if we don't have conditions for implementing it, then it's not worth it. So one of the second areas that we tried to work on was to influence funding. And this means to find ways in each country to make sure that conditions and the policy conditions around this shared vision were quite important. 2 supporting areas were also thought about on this. One was that research should be devoted to prediction and prevention, that is, to be aligned with this shared approach, and to consider what are the midterm and long-term needs of each region, each country, and in Europe as a whole. And this, of course, makes much sense when we think about what we had this year around COVID, for example. If our health and care system had been able to integrate all the developments of ICT and the building environment for longer, maybe things would be easy now. Of course, nothing of this works if citizens do not participate. So it is not in the sense that citizens are the ones that need to do all the work, but society only grows if everyone does its share. And SHAFE also has a big part on promoting active citizenship and the participation of everyone in order to foster a healthier life. So after this, we delivered the joint paper. It was more of a policy action, but there were 2 things that we thought needed to proceed, and they both focus on cooperation and implementation. So after 2018, we kept working, all of us together, and we tried to understand if, in fact, there was the need to bring digitalization to foster progress. What do we need to do in order to make sure that this is actually done for common good? So we understood that there were maybe 3 main axes where we still needed to progress. For sure, on the citizens area, there was the need for more digital skills, health literacy, more engagement in terms of participation in society, and all of this needed to take into account the inequalities on access that still exist, especially for the health and care sector. Of course, this only works if environments are also tackled, and this means having programs for house retrofitting, have better digital infrastructures, make sure that public spaces and transport are prepared to have these changes, and of course take into consideration sustainability and well, the Green Deal is here, but at the time this was already something we considered. And finally, health and care also have a lot of challenges, as we know. And if we want to have more digitalization, for sure, we need to have reliable and accessible data. We need to consider integrated pathways. That means also integrating health and social care a little bit better, and to implement guidelines and long-term funding solutions for the innovations that come. Because one thing that we know is that many times we have very nice projects, but then the funding in the member states is not fit to integrate them quickly. So we end up losing a little bit of the new solutions that we find. So we acknowledge that these challenges are all very much connected, and this is the main idea of SHAFE. So for 2020, we released a position paper. Many of the stakeholders contributed directly to it, and we tried to have very specific goals to foster SHAFE. On one side, to promote training of formal and informal caregivers, to try to promote a more coordinated approach to health and social care, to develop sustainable business cases that can be worked out with governments, insurance companies, and investors, to promote also a more modernized education, if we can say, to urban planners, architects, and ICT developers, so that they have a more multidisciplinary vision of the issues, and to support public authorities and health and social care providers on implementing SHAFE in their own regions and countries. So we identified maybe 7 main stakeholders that we needed to approach, and that is policymakers, insurance companies, citizens, financiers, health and care providers, academia, and the building industry. And we are really trying to do something with all of them. And this is a little bit of also what I bring it today, is how we are now implementing SHAFE and not just doing policy work at a higher level. So we have a lot of different projects being implemented by the multiple partners of SHAFE. I brought some of them in which Caritas is involved. One is a spin-off of SHAFE. That is the Portuguese network on SHAFE, which has already around 70 partners in Portugal. We know that other countries are already doing the same, which is every country has different ways of organizing itself, especially in terms of policy and funding. So it is good that we have some national spin-offs that can adapt what we are developing into the national realities. One other just approved and initiated last week is a cost action on smart, healthy, and friendly environments. It gathers now 213 stakeholders in Europe already, in 38 different countries, and aims exactly to promote these regional ecosystems around Europe that implement health and well-being in an age-friendly digital world. We are starting the works now for the next 4 years. I'm very honored to be the chair of the action and to be able to have so many people involved in this work. We do expect it to be a full quadruple helix work with different kinds of stakeholders and not that much just research oriented, and that it will bring some added value to have this holistic approach in so many different countries. Going to the objectives that we set up before, and coming from a very big action to a very small but very nice action, we are also working on a project called Hands-on SHAFE. It's an Erasmus project, and the main idea is exactly to deliver training modules to community facilitators. That is, one of the things we have understood is that many of the things should be well, tackled at community level, especially since family structure changed so much in the last years. So we are developing very hands-on training models to be developed by these community facilitators that can tackle a lot of the issues on their own neighbors and in small coffee shops and groceries, for example, and that eventually can make a business out of this, out of promoting social care in their communities. This is a training part, but we also have the policy part. And EUSHAFE is an Interreg project that is exactly trying to promote changes in policy and funding in 7 different European regions. So as you can see, we go up and down from very pragmatic and practical work into policy-oriented work. But the idea is always the same, is to have a holistic approach into the different angles of SHAFE. And I could not avoid to refer to the projects that were presented here. Pharaon was already presented by its coordinator, but specifically on the Portuguese pilot, our main aim is exactly to approach smart cities and the aging challenges, and that is to directly impact on the connection between the cities and the citizens. And this goes very much in line into outdoor environments and also housing, because these are really important areas to approach. Smart work, it's a bit the same, because actually we spend a lot of time in our work, and the office environment is also a very relevant area to work on, because if we don't have a comfortable and adapted environment at work, well, in fact, we spend a lot of time there. So it's not enough to work on the housing in terms of our homes, but it also makes sense to approach the working environment, and this is exactly what the smart work system is trying to do. And for another area, that is the connection between health and social care, we are also trying to implement in several different countries more integrated pathways and coordinate the 2 areas of care, especially aiming at having a more person-centered solution instead of having organization-centered solutions. As you know, in so many countries, we still have the person, the citizen or the patient going from here and there to receive different types of care. So in truth, having it connected and put together would make a big difference. Going also for national funding, this is something that may for sure be of interest also for Homes for Life, and I do hope that we'll be able to connect. This is a project that just started 1 month ago as well, but it goes directly on the built environments, and it has a big area of connecting the building materials and furniture, domotics, etc., with different areas of digital solutions and personalized care. So I do think it will also make sense to progress on this, because then we will have any digital solutions devoted to active and healthy life already being thought of when we think about the outdoor environments and the housing environments. And for sure, this will make them more scalable and more adequate. And just to finish with one of those small projects again, but that can also contribute for this holistic approach. I would like to mention a very person-centered project. It's a project where we train mentors, not older people, 55 plus. So I won't call them old anymore, but we train 55 plus to be city audits, let's say. They go around their own communities, try to see what can be improved, and this can be either in the built environment or in the access to health services, even in cultural activities, and they will make a report out of it. And we are helping them to summarize this and to present to their policymakers in order to propose specific changes in their own communities. So this is also a way to foster SHAFE and to have people proposing to be at the center and to foster their own change. And if we connect all of this, I am very positive to say that for sure we are approaching the issues in different fronts, in different perspectives, with a lot of stakeholders. So we can only expect that in a few years things will for sure be better. At least we hope. So thank you so much. That was my presentation, and I hope you have enjoyed it.
Thank you very much, Karina. So super interesting, and we have lots of things to talk about, because I think that we have been, all of us probably, we have been represented our projects in your presentation, some of them directly because you are also involved, but also for the ones that are not on your projects, I think there is a good way to walk along together. So now I will give the floor to Olat. She will ask some questions.
Okay, I will go on first with a specific question related to Homes for Life project. Stefan is asking about well, the question says, wouldn't it be better to create the taxonomy, the reference framework, and strengthen the local initiatives as the 60 existing ones, instead of creating a European certification scheme? So do you think that it would be better wouldn't it be better to improve the existing certification schemes?
Well, that's a good question. Well, in fact, the call of the program was asking for the creation of certification scheme. So it's something that we didn't doubt. But of course, we didn't start it from zero. We did take a lot of inputs and information from existing certification schemes, because, as I have said, our aim was not to reinvent the wheel. I don't know if that expression exists in English. Well, we wanted to, if there are a lot of things that have already been done, and those initiatives you are putting there, like OneCare and HSA and other ones, we did analyze them. We did also analyze some certification schemes existing in the United States, because they are quite active in this field of age-friendly housing and environments. And we did study them, and we did take some of the requirements have been taken from other certification schemes. I mean, if they are already working, we are not going to start inventing anything. What we did identify is that there was a gap in all those certification schemes regarding to those clusters I have explained you, and our intention was to cover that gap, creating this new certification scheme. But probably if you check it, if you go through it, you will find a lot of requirements that are present in many certification schemes, not just probably OneCare or HSI, but other certification schemes related to sustainability, energy efficiency, or quality of life, like HQE or other ones. So, well, I guess, I don't know if I am replying to your question.
And Sylvia, if I can add maybe a few words to that. So, as you know, R2M, we are also involved in the Homes for Life project. And more specifically, I'm following one of our pilots in Homes for Life, which is based in Nice, in the south of France. And what they told me, the stakeholders from the pilot site in Nice, is that actually for them, it's very important to have a certification scheme with a European dimension, because they consider that at the moment, there are many local certification schemes, but for them, they want to understand how their building compares and benchmark to other initiatives in Europe. So I think also for some stakeholders, they prefer to have a certification scheme which is a wider, I would say, coverage and really a European dimension.
Yeah, thank you, Reyes.
I have another question. Maybe this, well, I think it's for both also, but I will give the word to Karina this time. You mentioned about funding of these kind of projects, and how do you think that, well, maybe Irina can give us some light on that at the closing of this session, but how do you think that Horizon Europe will what will they provide for implementation of this kind of projects?
You mean in general or?
In general, yeah. Or safe,
Okay.
well.
For sure, a part of it, Irina can speak better than me, but I do imagine that for probably Horizon Europe is there to promote innovation, not to promote implementation in long term. I do think, and I have been defending it, that there needs to be more connection between horizons and national funding. I know this is somehow foreseen, at least this is what I was told, in Horizon Europe, but I'm not sure how far countries, the different member states will do this in fact. Because the truth for me, and I proposed this in the discussion groups for Horizon Europe, it would make a lot of sense that we could say, if there are X projects which have had wonderful results in Horizon Europe, for example, then let's talk to member states, and they have a share already defined exactly to implement this project in the field, because otherwise, I'm sorry to say this, but I feel sometimes we are wasting so much money, really wasting, because it doesn't do any good if we invest in a lot of nice research projects, but at the end, they end up and we start a new one. So it's true, of course, that we have a laying strategy, and this is a bit what I tried to show today, is that every project we have has a strategy for us. It comes together. It's not just because we got it approved. It is because it comes together to achieve something. But in truth, if at the end the regions and the countries do not accept this or do not collect these outcomes, because it should be the contrary, it should not be a favor. It is a way of developing countries and regions. If they acknowledge this, then that would be great. But if they don't, then I don't know if a program like Horizon Europe can solve this. I don't think so. I think they can maybe, this is my lobbying, they can maybe pressure a bit more member states that if they want to receive structural funds, they should allocate a part to this. But this is just lobbying.
And talking about the future, do you see an integration between the Homes for Life vision and the results of Homes for Life projects with SAFE in the future?
For sure. In fact, I didn't refer it because we are not partners. I was just in the advisory board, but Sylvia knows that either Caritas and even other initiatives where I'm involved, we are really interested in continuing this work, because I do think that it makes a lot of sense. If I can say something, I completely agree. This should be an European framework and not, and it should be something concerted. But for sure, this can be very helpful, and I do hope you have the room to push it forward. For sure, we are there as well to continue working together as we have been.
Yeah. Well, in fact, if I can jump in, the final purpose of the project, even if the more tangible result perhaps is the development of the certification scheme, because it's something that is a clear result that can be commercialized and used. But I think that the goal of the project is to define that vision for 2040 and to establish what are the paths to move forward in the different countries and regions to be able to have age-friendly housing, or to make policies to foster this promotion of age-friendly housing or life course housing, let's say, or homes. So I think that's the main goal, even if the result is the certification scheme. That is a tool we have, like many other tools that we have to use, like technology, that is a tool also. The final aim is to have a better quality of life and to live healthier and longer and better life. So that's something we always say, that the certification scheme is not the final goal of the project, is the result.
Okay, I don't know if any of the speakers have any questions for or any remarks to make. Otherwise, maybe we can jump already into the next session. What do you think?
We have now discussion. I think that we can discuss like if we were in a table with a beer talking, because I think that.
Are you not pressuring Irina to say something about funding? I thought.
She has a slot afterwards. I know she will make a presentation. I don't know if Irina, if you want to jump in now or you prefer to wait to your PPT.
To be honest, when listening to today's presentations, I slightly changed my slides already and try to focus them a little bit exactly on the future. And actually, all the points that you mentioned, and first of all, thank you both for your presentations. And Karina, this was really nice to see also. Because it is also a personal frustration to see so many nice projects being developed and then go nowhere. So it is nice to see that in some cases one could use also other funding, whether it's Interreg or ERDF funding, to maybe achieve a little bit more implementation, because indeed with Horizon Europe, it is foreseen that there will be a scheme in which results of projects will be made aware to member states. But the Commission honestly has limited resources to make member states, public, national or regional authorities do something. It is for them to take this decision to implement or to fund uptake of some solution in the region. But yeah, maybe we will do the opposite. I could do my short presentation, and I finish exactly with the funding for in the future, and we could then also have an open discussion about it, because we are still not closed the programs. Now with the whole situation has made it quite difficult to close the programs, because additional programs have been adopted and member states are working on their plans on what to do. Yeah, but yeah, I'll do my slides first, and then we could have also a slightly bigger discussion on that. So I take the presentation mode. And can you see my slides now?
Yeah.
Yes.
Do you see only the slides, or do you see also parts of the GoToWebinar small windows?
No. Yes, the slide.
Okay, good. Yep. You have probably seen this slide before. This is a short scope on what we in DG Connect, in our e-health, well-being and aging unit, have been doing, in particular in the last 7 years during Age 2020. This is our communication on digital transformation of health and care. And it has 3 main chapters. One is secure access and exchange of health data. And this encompasses all kinds of aspects. It is the quality of data, it is access to data, it is legislation and privacy and respect and compliance to GDPR. It is also cybersecurity, addressing such threats in health facilities, for example. It is, of course, securing exchange of electronic health records and health data between member states, and as recently announced, the so-called creation of a European health data space, which is on which we are working now quite seriously, because we would have to make sure that real-world data and data coming from industry, coming from sensors and devices would be taken into account. But then this is a discussion for maybe another webinar. Our second pillar, as we call it, is pooling data for better research and personalized medicine. And our, of course, biggest initiative is linking genomic data across borders, an initiative which started 2 years ago in April 2018. Today, it counts 23 countries, so 21 member states, plus Norway and the UK. And the aim is to give access to genomic data, which is scattered between different databases in the EU. The aim is to reach 1 million, so access to 1 million sequence genomes. It is important to say that those sequence genomes already exist in the EU, but as it often happens, they are scattered in different initiatives, in different projects, in different institutes. And the ambition is to make sure that this data could be used for better research and for better results and for better treatments. For different use cases, whether it is cancer, or whether it is common and complex diseases or rare diseases, and recently also now for infectious diseases, as proved by the recent outbreak of COVID-19. And our maybe third ambition is to, maybe most relevant to the work of your projects, is how to empower citizens to take an active role in their health status, in prevention, in their better to manage themselves with different digital tools. And we have funded around 200 projects this last 7 years. A lot of different projects with excellent results. As Karina rightly said, many of these projects, I would even say most of them, have a bit of difficulty then to be adopted and to really go to the citizens who need them. This is maybe a short overview of the different goals related to age-friendly environments or smart living environments, which we funded in the last 2-3 years. You all know the AEL program as well, which has been very active and very successful in deploying digital tools in different regions in member states, mainly on the regional level. And we have also worked on convincing on policy level our stakeholders and our hierarchy as well, that it is worth investing in silver economy, given that we all age, but our experience counts, and we could continue to be very active also beyond 60 or 65 years and contribute to this society with our skills. It is also a huge potential for growth in an economy when we adopt ICT solutions and innovative solutions, just as you presented today. into our daily life. And we have supported the European Innovation Partnership on Active and Healthy Aging, which has an important legacy to bring into the future. Maybe one of these is the creation of those reference sites, those ecosystems across the Union, which are devoted into working on active and healthy aging policies and into adoption of different solutions, not always digital solutions, to improve the health and well-being of older people. Now, recent developments, you have surely already heard that the Commission and the cabinet of Commissioner Schweitzer, who is responsible for democracy and democracy, has published in June a report on the impact of demographic change. And I have put now forward these main 6 findings: that we have a higher life expectancy, we are also expected to continue to live longer, and this life expectancy is expected to grow. We have fewer children, and in 50 years, when I will already be a very old person, then above 65 years, so people would represent roughly 1/3 of the European population. And above 80, this is quite a big percentage, 13.2. Of course, we will see how this would be in real life, but again, this is a quite substantial growth. Yeah, we live in a different way. We live in different homes, different families, monoparental families, or families without children, or people living alone. We have a different home composition than what we used to have some decades ago. We move a lot from regions, from one country to another. And logically, often we move from a less developed region to a more developed one, which leaves certain regions in a very bad preparedness to address certain challenges coming with a lack of young people in working age, or lack of adequate services, whether it is health or care services, or even transport, or any other public services. Yes, and we as a whole, as Europeans, are shrinking in our population with regards to the whole world's population. So, what is the aim of this report? It is to tackle the different issues that exist, whether on regional level, whether with regards to shortage of staff, whether with regards to health literacy or digital literacy in general. And what the ambition of Commissioner Schweitzer is to make sure that this situation, this report, is taken up by policymakers, and that adequate policies are put in place to address the different challenges. A follow-up work to this is the Green Paper on Active Aging, also led by her. which is expected to be published and adopted in January. We have been quite actively working to integrate inside lessons learned from our experience as a unit in managing many different projects, helping older adults to live independently with the help of digital tools, also with regards to smart and environments, but also with regards to health literacy, or with regards to, as the Smart Work project presented before, to make sure that the older workers are also can also continue to work, and to that employers adapt their workspaces for them. We expect also the publishing of a long-term vision on rural areas, and as I said, those are areas very often affected by demographic change in the harshest way. And also just 2 weeks ago, the German presidency and the council adopted conclusions on human rights, participation and well-being of older people in the era of digitalization. There is quite a lot of recommendations with regards to the use of digital technologies to address these issues. I am coming straight forward to the future. We are, as you all know, in expecting the next multi-annual financial framework. As said already, very often, results from projects, innovation projects, which were supported by Horizon 2020, are then deployed in member states with regional funding, or also European structural funding, or regional development funding. And I would encourage you to liaise with the, of course, by the end of your projects, we normally there is an exploitation and dissemination strategy. Make sure that, of course, your regional or national authorities know of the results of your project. The structural funding is very, very big, and very often it is the best way to achieve support from the Commission when it comes to real deployment. You know that in Horizon Europe, we would have also a new partnership on transforming health and care systems. There is now, following the COVID crisis, also a new renovation wave strategy, which has particular also, let's say, topic on funding smart, green and sustainable housing. I would look into the different calls and different plans on how to make use of this particular strategy. And the Commission has also adopted a very big recovery and resilience plan, 750 billion euros. The aim of this plan is to help member states and regions achieve ecological and digital transition following the crisis coming now with the effects of the COVID-19 economical effects also. 20% of this plan is devoted to digital transformation, and member states are currently very active in writing down their plans on how to make use of this recovery and resilience facility plans. Our Director General, DigiConnect, has its own Digital Europe program, which has 5 main pillars: investments in AI, cybersecurity, interoperability, HPC, and digital skills. And the aim is to really support deployment of these technologies all around Europe in all regions. Also with the help and increased creation of digital innovation hubs in all regions, how for the, let's say, diffusion and to allow local SMEs, innovators, to make use of these technologies, but also those hubs would have to make sure that they give appropriate counsel and help to innovators and SMEs on additional funding, on business plans, on how to achieve market uptake, so public or private uptake. And they should also help creating a bigger network across EU member states and regions between like-minded SMEs and innovators. And in this particular case, we talk about health. And also, maybe, maybe I will go further. Oh, this is all. Okay, so I would maybe exit now my full screen mode. Yeah, because this is more or less what we are doing, but we are learning also from you on what should be done. And I would invite you as participants today, and from your experience, to please take active approach also to us or other stakeholders in the Commission, and make sure to always communicate to us also your results, your policies, your lessons learned, because one and maybe most the easiest, we can also make sure that those are achieved further dissemination, but they are also helpful to us as policy officers to really defend what we are doing and our policies, and to continue to make sure that your projects succeed. Yeah, I think that this is all from my side. So I would be happy to continue active discussion with you, and if you have now more
Hello? Hi? I cannot hear anyone. I think that it has been perhaps Regis. Can you
Sylvia, sorry, I can hear you.
help us?
I can hear you, Sylvia.
Yeah. Irina, now? Are you there?
Yeah, I'm here.
Okay. I think that I don't know how we have muted you. It was not intended. I mean, technology is not always so friendly as we would like, at least for me. Thank you very much, because I think it has been really interesting. I don't know if any of the other speakers wants to ask you something directly. Karina is trying to talk, but I guess you have a problem also with your...
Yeah.
Yeah. You are asking for the presentation? No.
No.
What are you saying?
They are all mute.
They are on mute.
Yes, I was muted by the organizer. I had a message saying you are muted by the organizer. I could not unmute, sorry. So I was asking help. Thank you.
Okay. I think, I don't know, well, anyone. Perhaps Regis is wanting to launch us out from the workshop. No, I guess probably we touch something. So if someone, yeah,
problem should be okay. I don't know what happened.
Okay.
Should be,
if someone wants, everyone has the option to talk now.
Yes? Maybe, do you hear me?
Someone wants to launch any? Yeah. Yes.
Okay. Maybe what I forgot to say is that we have learned from these projects and from other coordination and support actions, of course, the importance of accelerators, the importance of ecosystems, and we have now different plans how to support the different networks of ecosystems, whether those are the European Clusters Alliance or whether those are digital innovation hubs and the different networks of them, because we see that very often it is on regional level and a very local level that something could really be deployed and used. So also on this aspect, I was very interested, Karina, from your presentation on the Activas project. So I would really be grateful if you, of course, if everybody, you could send me the slides from your projects today, because, yeah, thanks.
Well, Activus is a national project, but it's actually a national coverage one with around 25 partners around the country, and it's funded by the Portuguese 2020 program. So I will translate it and send you some information on it, and I'm glad that you are interested, of course. I would like to ask something, if I can, relate it to what you said. Is it okay?
Yes, please.
You were saying that you are trying to understand ways of supporting this clusters, networks, ecosystems, etc. But is it something you can already share, or are you just taking it into consideration for the reflection on the program?
So I could already share maybe 3 things. You know very well that I suppose you know that there is the European Clusters Alliance, which has clusters in all regions. I suppose that some of you probably are members of it or know about it. So we have had some meetings with them on a possible creation of a sub-network focusing specifically on health and a promotion of digital technologies for health. And another thing I maybe shortly mentioned, but not very clear, is that we plan to create a network of digital innovation hubs working on health throughout member states and regions. We have, of course, identified, although the process is that they self-identify normally as hubs working on health. And this will not come in 21 because it is very, very, very early for DEP to do that, but probably in 22 or 23 to call for such a creation and to strengthen the different digital innovation hubs working on health. And another thing, in Horizon Europe, we have been thinking to put forward the creation of, you know very well that there are different accelerators or different, let's say, repositories of solutions which exist from different projects. So whether this is the EIP itself or eHealth Hub or Digital Health Europe, there are all kinds of repositories of solutions which are beyond pilot or beyond proof of concept that could be already put into the market or adopted by any public actors. So we, oh no.
I think we have a battery problem.
Irina, in the worst case, we can still hear you. Since you are connected with your phone, I think it's going to work.
I wonder, can you hear me?
We can hear you,
Yeah.
Irina.
Yeah.
You connected.
Oh, you can hear me. Oh no, because my computer, so my laptop, the battery stopped, but I could continue to talk in the meantime. Yes, I'm sorry. Yeah, so we have now some plans in Horizon Europe to in a way create an integrated and sustainable EU-wide solution that such digitally enabled health solutions could be in one place. So one integrated EU-wide platform, which would ideally be visible to member states and policymakers in member states, and also to all the demand side of such technologies. So there are different ideas into what to be done, and of course in Horizon Europe there are all kinds of other different actions, but we also, or maybe I should speak for myself, I also welcome your ideas and also your recommendations, and maybe this is the right time to say that if you do have such recommendations, please just feel free to send them to me. I can share with you my email address also. Maybe this is just a general recommendation to disseminate your results with us, so with our unit or with other services in the Commission, because yeah, we learn from them as well.
Thank you very much, Irina, for your suggestion and your invitation to. Perhaps you are going to regret it, but we will. I think all of us we will send you our ideas. Well, you know, we have been talking before also. I think that something that it sounds not so well for me, that I think that's because of my background, is that everything is very much focused on health issues, But when we talk about aging society, it doesn't have to be, I mean, health is an issue, of course, but it doesn't have to be just health, because there is a lot of people that is aging and they are in good health and they can do lots of things. But sometimes it sounds that when we talk about age friendliness, we focus a lot of things on health issues, and perhaps we are forgetting other fields that we should take into account. I don't know if the rest of the speakers have that feeling or it's just mine because I am not from the health field.
Hi, Sylvia. Here's Anna from UPM. I don't know, can you hear me now with the computer also?
Yeah.
Okay.
Yeah. Yes.
I think it's a very interesting topic that you just have mentioned, and I think for me the bridge, let's say, between aging people, their health, and what else is important for them is that health is also their mental well-being. So for me, this is a big topic, and I think we have to forget that we should not only concentrate on their physical health, but for me, like especially in these days, isolation is a big topic for all of us, and even more for the elderly. So I think it can also cover this part.
Yeah. Of course, mental health is something that has to be taken into account. But I don't know if Karina, that you are perhaps more in between the both worlds, like in your project you tackle with health issues, but also with other issues. What do you think about that?
Yeah, I do think that we still have fragmented calls. So usually you either go for health or you go for build or you go for social, or this is a bit the whole point of SHAPE, is that we still go for fragmented calls, and it's very difficult to be able to push something into a different type of call. So we have been able to do it, for example, with Activas here, but it was a first. It's the first time we have built with ICT and social care and etc. For the first time, 1 week ago, our Ministry for Science was in the presentation of a collaborative laboratory where we are involved with different organizations. And they said for the first time that we now want social care involved in ICT and health, which is a first as well, because usually research ministers from science, etc., don't have anything to do with it. But maybe this is an outcome of COVID. So I do think that we have a very difficult time ahead of us, but we also have an opportunity now. And this is the time to try to make people understand that maybe some of the issues we are facing would be avoidable if other things were done before, but since they weren't, then maybe this is the time to do them. and I do think there is some kind of momentum in that terms. If we can push hard, maybe this may be moving a bit. But at the end, when we get funding, because they are sometimes divided by ministries and etc. in the national landscape, then everything is broken again. and although people defend a lot of things, when it comes to money, then it depends on their ministry and they won't go beyond this. We really need a different structure in terms of task forces between ministries and an overall vision. I think mostly we miss the vision. Decisions are taken by areas. They don't count on each other to then this is a bit sad because everyone can understand theoretically that this doesn't work, but then at the end we are always there. So when we look at Horizon Europe, it is possible that we still consider they are a bit clustered in terms of not being cohesive enough. But well, let's see. Let's see also what we can, how we can push you with our. Sylvia was saying you will be sorry. I think so, but we need to. All of us need to push because it's the only way to foster the discussion, even if it is not completely implemented. I think step by step we'll get there. I don't know, maybe I'm too positive today.
Yeah.
I agree with you that there is a momentum, and in fact, so yes, I represent the Commission, but the Commission is a fragmented place in itself, and to a certain extent, I was also very happy now with the current development on with this report on demographic change and the coming green paper on active aging, where we have pushed very hardly to put elements coming from our experience, which are related also to your project. So this is taken into account as a whole encompassing document, taking an holistic view, because obviously healthcare is by itself very separated often from social care, and then when it comes also to the building industry, then there is sometimes even a bigger separation. Yeah. Me as a simple project officer, I can push and my hierarchy to do so, or to, but at the end the decisions and the change of mind, and I think might really come a little bit faster than what we thought, unfortunately, due to this current crisis, because we all read that about the effects of isolation, not only for older people, but also for us, and for yeah. So yeah, I think that we do have a momentum now. However, whether we would have a really integrated calls in Horizon Europe that could address all these things together, maybe yes, yeah. You have to find policy officers who are, convinced, and push them stronger. And maybe it would happen, but yeah.
If I can give you an example, and now you are giving me an idea, and I will put you in contact, because I know you are open-minded to this, with DG Sante for this, and maybe Sylvia can bring someone from another DG, I don't know. But it was only approved as a thematic network in 2017 because a Horst was in your position previously, pushed DG Sante to do this together. It was the first network to have, the first thematic network to have two DGs, because prior to 2017 this never happened. It was always only under Sante, and sometimes things happen because good people are willing to do them. So
yes, exactly. Sometimes things happen. Yeah.
Yeah, I do understand that sometimes this is not enough, but sometimes it is. So yeah, we just need to try, and if it's wasted, it's wasted. But I do think that even if you are only an officer and you depend on hierarchy, still you are able to influence. Maybe not immediately, but you are, and you are an example of this in terms of congregating different projects and being available to discuss it and to push it as well. So I do think you can make the difference, and we will try to help you to do that.
Oh, thank you. You're in a very positive mood today.
Help you or annoy you to death, I don't know, but
it's the Halloween mood.
I don't know if perhaps Haris, you want to add something, because this is a woman conversation. I am saying we are all here talking.
Yeah, this is important stuff. I think Karina covered most of what I also had in mind, and quite recently I also have been involved with the Greek Ministry of Digital Governance, and we're looking also at the reform of health-related issues, among other stuff. And it would be really important, because the minister is trying to push the AI part also, that we are looking in the projects that I have been involved. And I think Karina is right on the issue about the fragmentation and the need for a unified policy among all the government bodies in Europe, expressed through the Commission to this end. Because if we don't do this, then none of these really nice services will ever reach the the final end user, which is the people, the people of the Commission. So this is a really big shame. So I think, you know, I support this, and from my side, I want to do what we can do best from the Greek ministry to do this as effectively as possible. Yeah, so I think it needs a change of mind, especially in these difficult times, as it was said. Yeah.
Yeah, thank you very much. I don't know if Anne-Laure, are you there? You want to add something?
Hi, yes, I'm here. For me, it's fine. Thank you very much for asking, but it was great to hear from all of you and to meet a lot of new faces and to hear some already familiar names. But yeah, it's fine. Thanks.
Okay, I just wanted to read the definition of, because this workshop started being sustainable housing to support health and well-being. I think that now seeing what we have talked about perhaps was not the perfect title for the workshop, but I wanted to read the definition of what is social sustainability. And I think that is more joined to this. And social sustainability occurs when the formal and informal processes, systems, structures, and relationships actively support the capacity of current and future generations to create healthy and livable communities. I think we are much more aligned with that definition, probably. So if nothing has nothing else to say, thank you very much. Thank you, Irina, because of your availability and good mood always to participate in these events with us and to discuss with us. Thank you, Karina. We will see soon, I guess. Charis, Anne-Laure, and of course Regis for giving us the opportunity and organizing us and avoid us doing any wrong technological things.
Thank you for the invitation.
Yeah, I hope we are in touch, because I think that what you have all presented has been really interesting for us. We will, Olatza and myself, we were like, interesting, you know, like we have to look at this webpage and so on. I hope we can work together jointly to push for some advances in this field. So thank you very much again. Thank you to the attendees. Not many people, but very loyal. So thank you and see you next time. Have a nice Friday and look after yourselves, because
it's a question.
Yeah, the health now is really, so look after yourselves and your family and friends. Okay, bye bye.
Thank you very much.
Bye bye.
Thank you.
Bye everybody. Bye.
Bye.
Thank you.